for those of you who have joined us here so far, thank you again. We're going to be talking about the National Health Service Corps on today's webinar. A link to where the recording as well as the slides will be sent in an email following the completion of this webinar. I am Caleb Lozinski, Outreach Coordinator with the National Health Resource Center, who is providing the webinar today. Your audio is muted by default to avoid background noise and feedback. Please remain muted unless you have a question. To unmute your line, please select the microphone icon in the lower left corner of your screen. If you have dialed in, press *6 to unmute your line. You can also communicate through the chat box, which is located in the bottom ribbon in the middle of your screen. The National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. The center is the TA provider for the Delta Region Community Health Systems Development Program. The Delta program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. The center is committed to diversity, equity, inclusion, and anti-racism, and building a culture where difference is valued. You may learn more about this commitment on our website. As I introduce our speaker today, I'll be pulling up a little bit of pre-polling questions. Just make sure I get the right one. Please feel free to fill those out when you can. All right, so as you can see on the screen here, we have wonderful Clark Conover, who is going to be doing this presentation today. Clark is the current Health Resources and Services Administration, Bureau of Health Workforce, and Division of Regional Operations Supervisor for Region 7 and Region 8. A 26-year veteran of HRSA Regional Office staff, Mr. Conover continues to oversee a staff of 7 who are impacting the lives of thousands of patients and clinicians over 10 states through the National Health Services Corps and other BHW programs. A native of Holstein, Iowa, Mr. Conover received his bachelor's degree from Iowa State University and his master's degree from A.T. Still University. He lives in Liberty, Missouri with his wife, Mary, and twin children. Clark, thank you so much for being with us here today. I'm going to stop sharing and turn it over to you.
Okay, can everyone see this?
Yeah. Nothing is, sorry, Clark, I do not see anything currently pulled up.
Okay, let me start sharing. We good now, Caleb?
I see your desktop background. Oh.
Do we have the webinar up?
Yes.
Okay. I apologize, folks. This worked in the preamble. So my name is Clark Conover. I am pleased to meet you today and talk to you about the National Service Corps. I was born in a critical access hospital. My folks are still getting their health care in the mid-'80s at a rural health clinic in Iowa. So I have a deep investiture to rural health and rural health medicine and the sustainability and recruitment retention of providers. The whole goal of today's presentation is to give you the information you need so that you can go to your providers and say, between now and May 9th, this is a program we want you to apply for. We want you to be able to be retained in our organization by participating in the federal loan repayment program. Now, BHW has over 90 programs. I provided Caleb with a PowerPoint of those 90 plus programs. It's about 120 slides, and it's a lot more than we want to go over today. If you have any questions about our training programs, our cooperative agreement programs, or anything else of those 90 plus BHW programs, please send me an email. I'll get you to the right people. My information is listed in this slide presentation, which Caleb will be providing to you as well. This is the almost third year of continual funding of this Nixon administration era program. We have seen increased funding over the last three presidents for congressional support of our program. It has provided crucial access to providers, clinicians, nurses, physician assistants, dentists in rural America, in Indian country, and in urban America to help become recruited and retained in those organizations, in those areas. The mission statement you can see there, and again, I'm not going to read the slides to you, but clearly it is to incentivize and provide financial benefits that are tax-free to get those clinicians into your clinics, put down roots, become members of the school board, the PTA, participate in church, synagogue, put down the roots in your community so that you can retain them. We know that the best way to recruit and retain a clinician is to retain the family. Access, supply, distribution, quality. These are some of the 4 aims that we'll be talking about today. You see a timeline here from the 1970s when it was founded to today. 47% of our 18,300 National Health Service Corps clinicians are behavioral health providers. So almost half. This is a reflection, we'll talk a little bit more of the programming of the national epidemic of opioid, fentanyl, substance abuse, alcohol, marijuana, etc., that is plaguing our country. National Service Corps is responding to that by really getting resources into communities' hands to get those substance abuse providers, those social workers, those licensed professional counselors in. You'll see then that almost the rest of it is made up of primary care clinicians and dentists. We know that the nurse practitioners and PAs in the rural health clinics across Delta region are primary sources of your care and as access point for your patients and your neighbors and friends. Again, we'll show a little bit more about the workforce. Again, you'll have these slides and you can delve into them. A little bit about the resources from FY23. We gave out almost 6,600 new awards. We received almost 3,000 applications for the scholarship program. We awarded 180. We have 46 states, the 3 trust territories, the District of Columbia participating in the SLRP, which is our ancillary program that's federally funded to the states. Our student service program we'll talk about. And again, of the 9,400 applications we received for the loan repayment program last year, we funded 6,600. An outline of what we're going to be talking about. Again, 18,300 people are currently members of the National Service Corps, serving just over 19 million folks. Our providers are providing access to care in your clinics to over 19 million people in the United States. All of these are in areas of greatest need. I'll overview the loan repayment program now. New this year is that if you have a Spanish-speaking provider, there's a $5,000 bonus payment to that provider. There's a proficiency exam they'll go on. If they pass that exam, $5,000 added to their loan repayment. Again, for a lot of you who may have seen influx, have packing industry, and some of these other things we see in rural America, this could be an enhanced bonus to bring a provider in who speaks Spanish. New. Last year was $50,000 for primary care providers. This year, 2 years, $75,000 for your first 2 years of your loan repayment contract. If you're providing primary care in a MICTA, you could be eligible for up to $25,000 in award funding. Again, we want to really recruit those family practice docs, those certified nurse midwives, those FPs and OBs that are seeing and delivering patients. Again, that $25,000 could be found to help increase that. Again, we're really trying to get the money into communities to recruit and retain your primary care providers. For those non-primary care providers, so your mental health, your oral health, $50,000 for 2 years. The biggest thing of this $50,000 in the $75,000 plus the Spanish-speaking bonus, plus potentially the FPOB or OBGYN or nurse midwife bonus. This is all tax-free. This is resources that go on top of their salary. This is resources that go on top of their bonus and benefit payment you're paying them. This is tax-free income to them to pay down the debt on their student loans. Before I go to the MICTA, You may ask, these are 2-year contracts, are they done? No, you can renew for 1 year, 1 year, 1 year, as long as they remain eligible, licensed, employed by your organization, and have a eligible loans. They can provide it. I think the record is 16 years. We had someone in the program now. After year 7, it drops to $5,000 from that $50,000 to $75,000 range. You drop down to $5,000, I believe, in year 7. But again, it's still a benefit in there. And that individual was with us for 16 years. He finally paid off all of his student loans. He was a psychiatrist in Western Kansas, of all things. So again, providing really good care in a really remote part of the frontier part of the country for 16 years. Became an institution out there, and we're very proud he's an alumni now. Maternal
Clark, can I
care.
ask a question?
Yeah, go ahead.
Hey, thanks. So you said you can renew for 1 year. So is that just 1 year at a time every year?
Oh,
And then
great.
how does the payment structure work? Because those were
It's
showing
one-
those were like 2
Sure.
years. Yeah.
Sure. I apologize if I was not clear. It's 1 year in perpetuity. It's 1-year contracts for as long as you have qualified student debt and you remain fully licensed and employed at your primary care, oral health or maternal child health, behavioral health site. So it's essentially about $140,000 over 5 years. After 5 years, the dollar amounts drop to $5,000. So as long as you have qualified debt, again, that individual was with us for 16 years, received $55,000 his last 11 years, which paid off a substantial part of his debt. He was Harvard Yale or Yale Harvard, one of those two. So very high debt from private institutions. But no, we don't kick you out of the program of this traditional National Service Corps loan repayment program. Does that answer that question?
Yeah. Yep, it does.
Okay.
Thank you.
The MICDAs are new this year. Its score applies to, you see these 3 categories. Again, you can receive bonus payments if you're providing obstetrical care as an OBGYN, FP doing OB, or certified nurse midwife. Those of you who are still in the Delta region that have deliveries at your critical access hospital, this may be a real boon. If they speak Spanish and they're doing deliveries, it's $105,000 for 2 years. A real impact to recruit folk. Again, I referenced a little earlier, this is on top of their salary benefits and all that. We have a YouTube video that you'll be able to click on here from testimonials from providers. Again, something you may want to share with folks coming in as you do your in-house visits with potential clinicians coming to work for you. And again, the loan repayment cycle is open from now until May 9th. And my goal is that all of you will be so motivated by this dynamic speech, you're going to take it right out to your clinicians and say, apply now. Loan repayment program eligibility, we talked about that. You see at the bottom, all the eligible disciplines. This is for the traditional program, the 53 years of offering this traditional program. Again, we'll provide these slides to you. All right, we have 2 new programs, each in their 4th year, that are companion programs to the traditional loan repayment program. These are called the substance use disorder programs. So this is for organizations that are providing substance use disorder. And there's a behavioral health checklist form you have to fill out. But if you're providing that care, your clinicians are eligible to apply for this program instead of the SUD program. I'm sorry, instead of the traditional program. It's $75,000 for a 3-year service commitment. And we'll have a slide a little bit later. They'll show all of the eligible disciplines for that. But again, you have to opt into the SUD program. It's on our National Service Corps website. Again, you can send me an email at any time and I'll give you all the links. But the links are at the end of this presentation as well.
So it doesn't matter how far out you are from when you graduated, correct? Like, let's say
Correct.
for 5 years or 7 years, and okay, so it doesn't matter as
Yeah.
long as you still have student loan debt.
You have to be a US citizen. You have to have eligible student loan debt. We will not pay for that spring break trip to Cancun you took your sophomore year at college, that you put on your Visa card that you got for free, allegedly free, or the money that Aunt Irma gave you. It has to be qualified debt, either through a bank promissory note or through one of the student loan, federal or state student loan organizations, and you have to have a eligible license. So, and again, we know with the credentialing that you folks are doing, you're not hiring folks that are not eligible with their license. So it's a pretty low bar. And everything, this entire application cycle is online. So there's no paper anymore. You're not faxing me anything, thank Lord. It's all online, and you simply put your information in there and hit send. A verification then will come back to the provider, from the provider to the site that says, yes, this person is working there. Yes, we have credentialed them, and yes, we support the application. Does that answer that question?
Absolutely. Yes, thank you.
Okay. The traditional SUD program, again, traditional $50,000, eligible for to doctors, nurse practitioners, CNMs, PAs, health professionals, so that's the master's level, health professionals, the social workers, family therapists, as well as substance use disorder counselors, registered nurses, and pharmacists. Again, they're all eligible for this program. $175,000, 3-year commitment, eligible those providers. Again, the site must be providing SUD treatment, not necessarily those providers. So those site must be providing. Now, the majority of you on this call will qualify for a different program called the Rural SUD program. We are offering bonus $100,000, 3-year service commitment. Now, these 3-year commitments are 3-year contract. They're not renewable, but you can go in and reapply. Unlike the traditional, which is renewable year to year, the SUD and rural SUD are not renewable. One nuance to the program. It's rural as classified by the United States Department of Agriculture. It's not by CMS or HHS. So if you're rural by USDA, you qualify for this program. You know, I jokingly say if you're not rural, go down to the Soil Conservation Service and complain. But someone actually did that, and I got my hand slapped. So please don't go down to your USDA office and ask them why you're not rural. There's a rural health index that's part of the application that you can look at. Again, this is USDA. Same requirements, same folks as the traditional SUD program. You're just in a rural community. Again, we're offering $25,000 additional bonus payments to get people into rural America. We offer a couple scholarship type programs versus student service. If you know any nurse practitioner, PA, dentist, physician candidate that's from your community that's about ready to enter the 4th year of med school that you want to come back, this is a great program. That's $120,000 tax-free in return for 3 years of service after graduation / residency. It has to be a HPSA of 14 or above. I had a dentist tell me, and dentists tend to be very good business people, that $120,000, if you pay that off on your principal up front, averts over 20 years, another $120,000. So this is essentially a $250,000 loan repayment that you're receiving for 3 years of service at a HPSA of 14 above. Again, physicians are eligible, dentists are eligible, nurse midwives or nurse practitioners are eligible, and PAs are eligible. So any of the primary care disciplines. You've probably heard of our scholarship program. Again, if there are people that you've worked with in your AHECs, have done rotations as medical students, or high school students that are going, or college students that are going to medical school, nursing school, to be a nurse practitioner, dental school, this program's for them. We will pay everything. So we pay for the degree and for physician, dentistry, PA or MPs, or certified nurse midwives. We pay for their tuition. We pay a stipend of $1,200 a month to them. We pay for their lab coats, their books, and everything else. It is an extremely good deal. You're stepping into a federal box, though. They need to understand they have year for year, from 2-year, 3-year, 4-year, year for year, payback in an area of high need. Every March, going into the last year of your training or residency, a HPSA score will be calculated based upon a 1973 law that will show you where that area of high need are. This year, you must be in for physicians and dentists, a HPSA and nurse practitioners, a HPSA of 18. For nurse midwives, a HPSA of 7, and for PAs, a HPSA of 5 or above. Again, we're trying to push these 200, 300, 400 students we have in the scholarship program coming out every year into the areas of highest need. There's the eligibility chart. So again, if you have someone that you think should be applying for the scholarship program, please encourage them to do that. And again, scholar site selection, the scholar applications, I believe are open right now, or they just may have closed. Again, if you go on our website, you can look. If you have someone eligible in a scholarship, the more work they do, more rotations they do as medical students or nursing students in underserved areas. If they come from an underserved area, if they're first in their family to go to college, these are all mitigating factors that will make their applications stand out amongst others. We have some links to member stories. Certainly, we'd encourage you to click on these and learn more about the National Service Corps from the impact we've had on providers. How awards are determined. Again, I talked about that. For the scholarship and the S2S, it's a competitive process. For the traditional, the SUD, the rural SUD, it's based on HPSA scores. So we fund the 26 HPSA, then the 25s, then the 24s. We extend down until we have expended all the funds, and the funds are bequeathed upon us every year by Congress. So whatever the congressional allocation is what we will expend. We do have other loan and payment programs there. I talked about the state program. Every state has a different application cycle, different dollar amount, different rules. It's your state primary care office. If you do not know how to get a hold of your state primary care office, I can provide that information. Just email me directly. We also have a nursing program that's scholarship. Again, these are for RNs, CNMs, and NPs and nurse anesthetists. They can be in any setting, such as a hospital, a nursing home, a veterans home, your clinic, rural health clinics, federally qualified health centers, etc. It's a very broad-based eligibility for them. And then we have some other programs too that will be highlighted in that 80+ slide presentation that Joby sent, but I'm not going to be giving.
Clark, it looks like we also do have another question in chat.
Go ahead.
It says, can you tell us how many scholarships are awarded?
Sure. We have a pot of money for the scholarships. It will depend every year based upon the dollar amounts. As you can very well aware, the osteopathic school in Pikeville, Kentucky will cost more to go to than the University of Kentucky Med School. So there is a factor there based upon the scoring system of your application. They take out the money of the first person awarded, how much does their med school cost, or dental school, then the second, then the third. So each of the dollar amounts are going to be a little bit different depending where you go to school. I think last year we did 180, 85, 200 scholars. It will depend on how much money Congress gives us. 4 years ago, in 2021, I think we did the most scholars ever, which was 400 to 450. Again, Congress was very generous that year with administration support. It does ebb and flow a little bit, and it does depend on the tuition for the institutions of the people who are prioritized 1 through 400 in the class. I can't give you a precise answer, but that's the best answer I can give you. This slide 44, mark it down. This is a side by side. So it covers everything I talked about in one slide. You might be asking, what is a approved site? Rural health clinics are approved sites. They have their own HPSA score, or they can use the regional score. Your outpatient clinics at your hospital are eligible. Private practice, maybe you have a private practice in town. Again, now the organizations have to have a slide fee scale. Again, that was put in 1973 law. That's offering folks at 200% poverty and below based upon documentation that they are indigent or below the federal poverty level, and there's a discount you can offer them. We can work with you on a one-on-one basis to ensure that if your site's eligible. Every 3 years, you have to renew that application. On the nurse corps side, there's not many sites except federal prisons and state prisons that are not eligible. The critical shortage facilities on the nursing side is really a catch-all. Support resources. Again, we partner with SAMHSA. You'll see enough. We do a lot of these trainings. You'll see us at your national state conventions, hopefully, on your rural health side or on the opioid delivery side with booths or presentations. There's a number of links there to go to as well. We talked about approved sites. There's a link there to the eligible site type, which is everything you see here. And I would make the bold prediction that pretty much everyone on this call fits into one of these categories. We also, for the SUD piece, if you're doing office-based treatment, if you're doing OTP, office treatment opioid treatment programs, you're also eligible for that's for the SUD and rural SUD programs only. So those if you have an opioid program where you're doing OBOT or OTPs, those sites will qualify for the SUD.
Another quick question here, Clark.
go ahead.
Do you, there's a fairly newer designation called the Rural Emergency Hospital, an REH. Do you know if they are
Yes.
also eligible?
I was going to come to that at the end. We begin this question a lot. At this time, REHs are not eligible. Critical access hospitals are. That decision was made in Washington. I have not seen the guidance for 2025 yet, FY. So I don't know I don't know whether there will or will not be a change for that. The critical access hospitals, as long as you're paired with a rural health clinic, community outpatient clinic that are either independent or provider based, you can serve time at both the critical access hospital and the rural health clinic. Small community hospitals and REHs at this time are not eligible.
Okay, thank you.
And that decision was made in October of 24. We have regional offices. We have over 65 people that are there to answer the phone, answer your email all across the country. If you have difficulty reaching a regional office, email me directly and I'll make sure you get a return call that day. One of the benefits that sites have and that providers who are clinicians looking for jobs have is what's called our Health Workforce Connector. We've partnered with Google. So we come up very early in your Google search. If they're searching for your location, you can customize your own personal page for each one of your sites. You can put all the narrative you want, links to civic organizations, links to your Chamber of Commerce in there, put all the pictures you want of the staff, of your facilities, whatever you think will attract attention. And then you can put all the vacancies that you want in there: nursing, primary care, mental health. We've had some critical access hospitals even put in there for their surgical staff or phlebotomists or whatnot. There's no limit on that. So use us. The clinicians go in and who are scholarship clinicians or S2S, and they can upload their own personal information so you can search for them. We're lagging a little bit on having the folks do that, but we're making a real concerted effort to get more clinicians in there so you can search and connect with them directly. This goes into more. There's a picture of of the Tulalip tribe in Puyallup, Washington. what it looks like. They've done their site, all the narrative in there. They have a picture of their clinic, 7 vacancies they're advertising, their HIPSA scores. Again, this is how you effectively promote yourself. It's free. We do virtual job fairs. The last one we had, we did a rural only virtual job fair. I think one of the last ones we had was in October. We had over 500 clinicians and 65 sites. If you sign up on our website for the virtual job fair e-blast, these 65, we limited to 65 organizations. They fill up extremely quickly. So make sure we're not in your spam folder. You each have your own Google room where folks can go into your room and come out of your room. The 550 clinicians, it's over 3 hours. It's been very well received. We've had really good feedback from sites that they've been able to contact and connect with people they normally wouldn't have, that are now interested in being courted by that organization for a potential job. A little bit more of what I just said. We have Facebook, we Twitter, we have an Instagram account. Again, you can put your information on there if you hashtag share your service for your clinician, alumni, your sites. If we're doing a good job and you think we're doing a good job, please feel free to tag us. There is the links to all of the information. Questions?
Yes, please feel free. If you have any questions for Clark, you can put them in the chat box or just come off of mute too. If you want to get a hold of Clark after the fact today, he did put his email in there. I will also be sending out an email with the event page where the slides and the recording will be housed. I will also make sure that Clark's email is on there so that you can refer back to it if need be. I will also be pulling up some. Oh, we got a great question here. Do you see good turnouts for the virtual job fairs?
Yes, we've been averaging 550 clinicians, all categories, from social workers to dentists to doctors, at our last half dozen of them. We do some specialized ones. For example, we do one just for rural. We do one just for behavioral health providers. So there are categories. The rural one was for all folks. We work closely with Tom Morris and his staff. I meet once a month with his staff to say, what can we do more? We have a real focus on rural. We've been trying our best to connect with the rural sites to get more of them in our program. This year, we've done a national strategy such as these presentations. We are going to look and do some state-specific strategies next year in some of the states where we have lower penetration rates of sites that are participating in the National Service Corps program. We're continually refining and redefining our methodology to try to reach out to more folks. A lot of the sites that we bring in is for retention. You've done a good job recruiting your PA, for example, and you want to keep him or her. Them. How can we provide those tax-free dollars to do that? So, does that answer the question, Caleb?
Yeah.
Oh, okay, perfect. There you go. As we're waiting for more questions, I will be pulling up the post polling. It's a little bit lengthier than normal. We're going to switch up the way how we do it, but if you wouldn't mind filling those out, that would be fantastic. Otherwise, yeah, feel free to ask any more questions. Well, if there aren't any more questions, feel free to take off and have an early lunch after you fill out the post polling. And again, if you have any questions that you don't feel comfortable asking here, Clark's email will be available to you in the email that I'll send here in just a little bit. So again, thank you to Clark for being here and being a wonderful presenter and giving us this great information, as well as all of the audience members today for showing up and being a part of this conversation. It's been wonderful. Thank you again so much, Clark. Everybody have a wonderful rest of your day and have a great weekend.